Thank you all very much for coming to our talk. I'll give a quick update. I have no disclosures. So our objectives are going to just go through our FDA-approved intragastric balloons, a few of the non-FDA intragastric balloons, quick review of outcomes, the contraindications, current utilization, and then the complications is where we'll focus. So starting kind of with the earliest FDA-approved balloon, the ReShape balloon was approved about 1 month before the Orbera for BMI of 30 to 40 and one or more obesity-related comorbid conditions. It's positioned endoscopically with a guide wire in place, and once you remove the guide wire, you fill the balloon with a sterile saline and methylene blue solution, sealed it, and you leave it in place for 6 months. The average procedure is about 8 minutes, so very quick. The removal is scheduled at the time of placement, and it's removed at 6 months based on FDA guidelines. And it's you use just an aspiration needle to remove the fluid, and then an alligator grasper to remove it. The reduced pivotal trial it was used to evaluate the ReShape balloon in 326 patients. It was a double-blinded, randomized, multi-center clinical trial with 187 patients getting the balloon and 139 patients undergoing lifestyle changes. And there was a significant increase in percent excess weight loss with the intragastric balloon compared to lifestyle changes. While there was a slight decrease in overall percent excess weight loss, there was durability in overall weight loss from 24 weeks to 48 weeks. Concomitantly, they also noted improvements in metabolic components of hemoglobin A1C, lipids, and blood pressure, and then overall improved quality of life scores using the SF-36. And similar series that have come since then in retrospective fashions have demonstrated similar results. Our next approved balloon was the Orbera in August of 2015 for BMI of 30 to 40. It's also placed endoscopically using a guide wire and then filled with saline, and it's removed again at 6 months. And a randomized controlled trial that was done after proof of concept was completed, it was FDA approved, compared 125 patients with the intragastric balloon and 130 with lifestyle changes. And if you note in the graph, there was a demonstrable improvement in overall weight loss for total body weight loss at 3, 6, 9, and 12 months out. This is a meta-analysis that examined multiple studies. Orbera has been studied for over 20 years. And overall, on average, there's about a 25% excess weight loss average, but there's a significant variability as noted in the final column. And the last FDA-approved balloon that we have today is the Obalon Balloon, which is an air-filled balloon or gas-filled balloon that was FDA-approved in September of 2016, again for BMI of 30 to 40. It's a swallowable balloon capsule that requires the patient to swallow the capsule on the end of a thin, long tube. About 7% of the time, they don't tolerate swallowing the balloon, and there is a risk of, if you bite down on the catheter as you swallow it, you can fracture the catheter and interfere with the inflation of the balloon itself. Then you confirm placement of the capsule into the stomach, either with fluoroscopy, which is likely the easier, cheaper way to go, or the Obalon navigation system, which is another X-ray system to confirm placement. And then there's an inflation device that helps put in a patented gas to fill the balloon with about 250 cc's each. And over the course of several weeks, patients swallow typically up to 3 balloons. The Obalon balloon has been studied by one of our speakers, Dr. Moore, in a double-blinded, randomized sham-controlled trial comparing the balloon to, again, lifestyle changes. And overall, there is a 7.1% total body weight loss with the balloon compared to 3.6% at 6 months. And then 88% of these patients maintain their weight loss from 24 to 48 weeks. And now they also have a registry that's available online for physicians who utilize the Obalon balloon to track data. The first study of that registry has been published, I believe, December, or was available December of 2018. And it includes 1,300 patients, or a little over 1,300 patients, with 70% of them falling within those FDA guidelines of a BMI of 30 to 40, a few with a lower BMI, a few higher with a higher BMI. And overall, the percent excess weight loss is somewhere between 6 and 10% total body weight loss. There are many non-FDA approved balloons that are being utilized worldwide, but I'm going to only focus in on two real quickly. The SPATS balloon, which is a spherical silicone balloon that is placed endoscopically filled with saline, and it's currently being studied in the United States, and you get weight loss up to about 20%. And then the Ellipse balloon by Allurion. It's a spherical balloon that actually you swallow and then fill with 550 cc's of saline. And then you don't need to retrieve this endoscopically. There's a catastrophic valve that degrades at 4 months, and then you just pass the balloon. So no procedures are required at all. And at this point, at 4 months, there's about a 10% total body weight loss. Again, this is also being currently trialed in the United States. While these are simple procedures, very quick and easy to do, there are absolute contraindications of having a Bezor effect in the stomach. An absolute contraindication for the 3 FDA-approved balloons is previous gastric surgery, a large hiatal hernia, esophageal motility disorders, coagulation disorders, potential bleeding lesions in the stomach, pregnancy, breastfeeding, alcohol or drug addiction, and severe liver disease that could cause portal hypertensive effects to the stomach. And then relative contraindications are previous abdominal surgery, hiatal hernias that are smaller, inflammatory bowel disease, NSAID use that can cause inflammation of the stomach as well, and uncontrolled psychiatric disorders. So utilization, I included some of our experience at Washington University. We're a low volume center. We did 14 intragastric balloons in 2017 and about 15 with no increase in balloons, partly due to our utilization of the Aspire Assist and the endoscopic sleeve gastroplasty. And actually the ESG for our center has increased exponentially to where we have in 2019 already done 8 cases, and our volume of balloons is decreasing. And then in the United States, ASMBS has published data that they've collated that showed about 2.75% of all the bariatric procedures done in the United States in 2017 were intragastric balloons, so about 6,000 cases. Worldwide, Orbera has placed or published that they've had 277,000 balloons placed over 60 different countries. And Obalon, I was only able to get the data from the registry. It's about over 1,300, and ReShape actually wouldn't share their data with me. Interestingly, we're now starting, since we are studying these more frequently, we're doing more balloons. We are now collecting that data via MBSA QUIP, or the Metabolic and Bariatric Surgery Accreditation Quality Improvement Program, and we add it to our database. So those patients have been included since 2016. And this study was actually based on the PUF data from 2016, and it looked at all the patients that had balloons, or IGB, and compared them to laparoscopic bariatric surgery in a propensity matched analysis, since there were only 781 patients who had the balloon and over 140,000 who had had laparoscopic bariatric surgery. And in the propensity matched analysis, the balloons had a higher rate of adverse events, although most of them are not severe, they're very mild. And they were also had a 4-time higher non-operative reintervention rate of readmissions and need for swallow evaluations or endoscopies. Most of these were due to nausea and emesis, which is a 55% instance, and then going down from there, abdominal pain and bleeding. And the second most common is actually other, just a catch of all complications that can occur with balloons. And transitioning, since the onslaught of the FDA approving these 3 balloons in 2015 and 2016, there have been 2 FDA warnings that have come out. In February of 2017, the FDA noted 2 unanticipated adverse events, of one being overinflation and the other acute pancreatitis. The overinflation was the liquid-filled intragastric balloons, or the Orbera and the ReShape, where it was noted that patients had severe abdominal pain and distension, difficulty breathing, nausea and emesis, and when x-rayed, it noted that there was some air within the balloon. And some of these required explantation, and there have been a couple case reports of these actually being associated with either fungal overgrowth or bacterial overgrowth, thought to be related to PPI use during the first 2 weeks. And then also acute pancreatitis, which occurred as soon as 3 days after implantation. And the thought here is the balloon actually compresses the GI structures, creating, or from the implanted balloon, causing pancreatitis because of the backflow or obstruction of the pancreas, causing severe abdominal pain and back pain. All of these required explantation of the balloon, and 4 of the patients required hospitalization. And then the second FDA warning came out due to unanticipated deaths. There have been 12 deaths worldwide and 5 unanticipated deaths in the United States within 30 days. 3 of them were related to cardiovascular events, and 2 were related to organ injuries. 1 was a gastric injury, and 1 was esophageal injury, either with placement or removal. And at the time of this FDA warning publication, there had been over 56,000 Orbera specifically placed and over 60,000 intragastric balloons placed worldwide. And so when the ASGE examined this, the risk of death is very low at 0.01%, but the fact that they were unanticipated was a concern. Other risks with the balloons, the risk of explantation is actually pretty high. It's anywhere between 6.4 and 18% of the literature. This usually happens within the first month, but can be up to a couple months out. And it's most commonly related to severe nausea or vomiting that's refractory to medical management, or severe acid reflux or abdominal pain. And then a few of the explantations are actually not related to symptoms, but the balloon didn't hold either air or fluid for some reason. And how would you tell? If there's methylene blue, you'll note it in your excrement. If it's a gas-filled balloon, it may cause some symptoms of abdominal pain due to a partial obstruction of the gastric outlet. The most common concern that patients have is nausea and vomiting that can lead to dehydration and readmission or need for explantation. And up to 73.8% of these patients in all studies have demonstrated some kind of nausea, and most of it lasting for less than a week, but up to 10% of patients will have symptoms out to a month, and over 4% of patients will have it for longer than that. And about 50% of these patients will have emesis as well, but usually the emesis resolves in a week and the nausea after that. Interestingly, while you don't have the same mass effect with the gas, there's still a significant nausea effect due to the just space-making component of the balloon acting as a bezoar. And these patients also have about a 50% risk of nausea and 17% risk of emesis. So this is our nausea protocol to try to improve upon it. We start prior to placing the balloons. We use a PPI starting a week before, and then we ask our patients to place a scopolamine patch the night before surgery, and we leave that on for 3 days. And then the morning of the procedure, we have them take Amend, which is an anti-nausea medication typically used around the time of chemotherapy in cancer patients. And it has a long-lasting effect of about 3 days. It is expensive, but considering these patients are paying out of pocket $8,000, $100 to them isn't usually too much money to get one pill to help with their nausea for the first week. And then we keep them on Zofran and Levsin starting after the procedure. And then as needed, we give them a prescription for Ativan to also help with nausea, and then Magic Mouthwash, considering the fact they have for the endoscopically placed balloons, we both have a scope and the balloon device going down at the same time, so they tend to have a sore throat. Abdominal pain is also one of the more common symptoms that can occur, but usually this completely resolves within the first week with 90% resolution, and significantly lower in the gas-filled compared to the liquid-filled balloons. Again, the liquid-filled balloons are heavier, they're going to sit heavier in the stomach and likely cause more pain. And interestingly, with the mass effect, you get some gastric emptying changes. And about 8 to 9% of patients will have delayed gastric emptying, where they have retained contents of a radiolabeled meal still present at 2 hours. And comparing these to actual GI hormone changes, there's no change in ghrelin, but there has been noted to be a decrease in cholecystokinin, and that's the thought or mechanism that may be leading to the delayed gastric emptying effect. You can see ulcers with the mass effect on the abdominal and the gastric wall in about 10 to 30% of these patients, and they're typically near the gastric incisura. Specifically for the ReShape, they had a higher rate initially using with their initial mechanism, and it was related to the distal device tip, and they modified that tip, and actually their gastric ulcer rates dropped to less than 20%. 30% of these patients will have acid reflux, but interestingly, only 5% of them will have actually significant esophagitis, and this is a picture at explantation 6 months after a fluid-filled balloon, and you can see pretty severe esophagitis there. And then One of the things that I worry about the most and yet have yet to see is bowel obstruction due to a spontaneous deflation unexpectedly. This can occur somewhere between 3 and 23% of the time. These images here, you can see actually a deflated balloon stuck in the bowel causing an obstruction. This required a surgical intervention to remove the balloon. Sometimes you can get them out endoscopically as well. If it causes a gastric outlet obstruction because of migration from the body and incisor area down to the prepyloric antrum, this can be removed just endoscopically. And very, very rarely, meaning 0.1% of the time, you can get a perforation or peritonitis. Most of the reports on this are related to iatrogenic injury of either placement or removal. And one of the deaths that I can recall on the top of my head is related to an iatrogenic injury on placement in the esophagus. And then one patient has been reported in the literature with having a perforated ulcer with a gas-filled balloon. The patient was non-compliant with the PPI and taking NSAIDs and had a cratered ulcer, as evidenced here, requiring a laparoscopic gram patch. So in conclusion, there is improvement in weight loss and comorbidity reduction compared to lifestyle changes, but there is a very high risk of adverse events. While they're not severe for the most part, they can be life-limiting compared to laparoscopic bariatric surgery. And so it can lead to explantation and a high cost to the patient with not as much benefit. And while the severe adverse events are low, it is something to consider and note and make sure your patients are aware of. Happy to entertain questions.